Community Health presentation by Lisa Akhtar. Agenda. This presentation reflects my 30 hours volunteer experience at lunch break in Red Bank, New Jersey. I will begin with a community windshield survey and introduce the agency. We will explore its mission, services, and population served. I will present relevant public health data that inform the intervention, followed by a description of the educational plan, implementation, and evaluation process. Finally, I will share key reflections and recommendations to address food insecurity in the vulnerable community. Windshield Survey Overview. Red Bank is a diverse town with visible economic contrast. While the downtown area thrives, surrounding neighborhoods shows signs of poverty and food insecurity. Many lower-income residents live in multifamily housing with limited access to full-service grocery stores. Public transportation options are sparse, affecting residents' ability to access essential services. The social determinants of health, particularly food access and housing, shape health outcome in area. Community Agency Overview. Lunch Break is a trusted nonprofit community that serves individuals and families experiencing hunger and hardship in Red Bank and surrounding areas. Founded in 1983, its services include daily hot meals, grocery distribution, a clothing boutique, and social services. The organization runs primarily on donations and volunteer supports. Its warm, welcoming environments aim to restore dignity and hope. Their holistic approach addresses both immediate and long-term needs. Mission and goals. Lunch Break's mission is to freely provide food, clothing, and life skills to community members in need. They work to break the cycle of poverty by providing self-sufficiency. Their long-term goal is not just to feed people, but to empower them through job training, life coaching, and community connection. This aligns with the goals of community health nursing, addressing root cause of health disparities through education and advocacy. Current programs and services. Lunch Break provides a wrap-around services to meet basic needs and support long-term growth. The food pantry and daily meal programs address hunger, while the Suit Up Boutique offers clothing for interviews and jobs. Their Life Skills Center provides resume support, computer training, and job placement assistance. Youth-focused programs include mentoring and school supply drivers. These services support multiple levels of the social ecological model of health promotion. Vulnerable populations served. Lunch Break serves a highly vulnerable population, including those living below the poverty line. Many clients are unemployed, underemployed, or homeless. Seniors rely on fixed income and often face barriers to healthcare and healthy food. Immigrants may face language and legal challenges that limit access to services. This population are high risk for poor health outcomes, including malnutrition, chronic illness, and mental health issues. Public health data. Recent data shows that over 994,000 New Jersey residents experience food insecurity, with even higher rates among children and seniors. In Monmouth County, 6.4% of residents face hunger. Food insecurity is strongly linked to obesity, diabetes, and cardiovascular disease due to reliance on low cost processed food. These facts support the urgent need for health focused community education. Needs assessment summary. My observation and conversation with clients reveal that most rely on canned or processed food due to affordability and convenience. Many lack Many lack basic nutrition knowledge and report chronic conditions like hypertension and diabetes. Health literacy is low, but interest in health and nutrition education is high. This finding helped shape my intervention, which aimed to teach affordable, healthy food habits tailored to pantry items. Educational, inter- Educational intervention plan. The intervention was a short workshop titled Healthy Eating on a Budget. It targeted lunch break clients and focused on improving food choice using pantry staples. The session used Arnold's adult learning theory, which emphasized self-direction and practical relevance. Objective covers knowledge, nutrition fact, attitudes, health choice, and behaviors, meals planning. The goal was to empower clients to make a small, realistic change in their habits. Implementation of the intervention. The educational session was concluded on site in the community share space at lunch break. I used visual poster, printed brochure, and real pantry item to guide a 30-minute session on low-cost nutrition. Key topics included label reading, portion control, and meal planning using donated foods. The audience was engaged and asked thoughtful questions. Materials were easy to read, culturally sensitive, and designed for varying literacy level. Evaluation methods. To evaluate impact, I administered a short pre and post session quiz covering basic nutrition concept. Client also related their confidence in making healthy food choices. Quiz results showed improvement and verbal feedback indicated appreciation for the accessible approach. Many participants stayed after the session to ask follow-up questions. These outcomes support continued educational intervention and highlighted the importance of reinforcement over time. Recommendations. To build on the session's success, I recommended holding monthly workshops to reinforce learning and reach new clients. Materials should be translated to accommodate Spanish and Haitian Creole speakers. Collaborating with local farms or food co-ops could increase access to fresh produce. Cooking demos would make the lesson more tangible. Lastly, grant funding can support expansion of health education initiatives to sustain long-term community impact. Reflection on experience. Volunteering at lunch break gave me a powerful, real world perspective of food insecurity and its health consequences. I gained confidence in my ability to design and deliver effective public health education. Working directly with clients taught me to listen, adapt, and communicate clearly. This experience strengthened my cultural awareness and deepened my commitment to community-based nursing. It confirmed that even a small educational intervention can empower people to make healthier choices. Thank you. Thank you.